Hi, I'm Ashley Adamson, and today I'm dealing with my healthcare. Like, my place is a mess. There's no makeup. Like, look at this. I've got all of this paperwork here because I'm trying to figure out how to get covered for a vaginoplasty. I actually haven't made the decision if I want to have a vaginoplasty. But get this. In America, you can basically talk to a psychologist. They can sign some paperwork and then say, you can get a vaginoplasty. Here in Germany, there's all sorts of roadblocks. And I'm also dealing with a different language. And the minimum is that I have to wait 2 years to see seeing a psychologist. And then I can get covered by health insurance. But, to get an appointment with a psychologist is the hardest thing in the world because public health care means everyone can get a psychologist. And now that everyone can get a psychologist, it also means that there's no available psychologists. So yes, it's a 2-year waiting line, but you need to get into the waiting line. And there's no one that I've been able to find to get in the waiting line in the past year. So it kind of brings me to tears because I feel so blocked on being able to initiate this kind of process. And it has me thinking about kind of sharing my own story and also sharing and relating ways that I've kind of handled and been able to kind of keep moving forward. Because being trans involves the healthcare system and it involves a lot of frustration, perhaps feeling invalid, and also feeling like you're not heard or cared about. And that all can really hurt, especially as you're going through your transition or even trying to start your transition, right? Where are you in your journey and how's it been so far with the healthcare system? Have you been able to find what you need or are you still trying to figure it out? Is it frustrating you? Do you feel lost sometimes? We're going to talk about some ways in which to approach this and some things that have helped me. But first, I just want to tell you kind of like what's been going on in my story so that way you can kind of see what's going on that I'm dealing with. So I'm 3 years on hormones, a little over 3 years. So I've got my hormones. I figured that out. I changed my name, I changed my gender, I'm covered by health insurance, all of that. But in Germany, I can't get injections anymore. So I've actually been, to get my healthcare needs right now, I actually get my estrogen from abroad and it gets shipped to me. And it's made by a Ukrainian chemist who's trans. So it's like kind of underground and not really like made in a lab by, I don't know, Pfizer or something. It's made in a lab by a chemist, but this chemist is trans and is kind of just doing it on their own operation, which seems kind of janky for such a, impressive healthcare system in Europe where they just block you on getting fundamentally healthier ways of getting estrogen. And then there's like this blocker in my vaginoplasty that I'm dealing with. Had I not come to Germany though, already several years transitioned, you have to actually spend a year fully out and living as whatever gender you are without taking hormones before you can even begin hormones. I don't even know how that'd be possible for me to dress up as a woman and to try to be a woman in public when I'm not on hormones and I don't even pass. Like I didn't pass for a very long time. And so, heart goes out to anyone in Germany who's trying to do this, and heart goes out to anyone who's actually like super, super blocked in their healthcare system. I think the United States is probably one of the easier places to transition, but if you're not in the United States, like, whew. So kind of like the way that I've approached this has been very practical and pragmatic, and the way that I've approached my entire transition has been very practical and pragmatic. And I know that sometimes on this channel we talk very deep and emotional, but I'm a very calculating and pragmatic person when it comes to execution and doing things. So I want to share some of this. And then I also want to combine that with some emotional and mental work. So the kind of like the execution side of things. I think the thing that really helped me a lot is to create to-do lists, to do research, to continue to kind of watch what other people are speaking and talking about, like you're doing right now, and to then use that information to my advantage to have discussions with my doctor. So when I first started, it was just trying to figure out where to get hormones, how to get a prescription, all of that, and reaching out and asking other people within the trans community what to do. That's a really great resource if you can find one. There's a lot of Facebook groups, but you can also call the Trans Lifeline. They can help you. As an operator, I have answered calls and given people information for getting their healthcare sorted. There's this thing in America called informed consent. I'm not sure if you're aware of it, but informed consent basically allows you to kind of skip the entire process of going through a psychologist and all of that, and you just sign some paperwork and you can start your hormones. I don't know if that's on all states, but that is something you should be aware of. The other thing is not trying to force it to happen, because sometimes you get blocked. And the initial reaction, I don't know if this is going to be your initial reaction, but when I get blocked, like if the door is not opening, you may kind of try and want to pull it harder or push it. How do you react? So pushing harder is often a recipe for getting more frustrated and making it harder on yourself. So I wouldn't recommend that. I'd actually recommend you pacing yourself and taking your time. Does that sound more reasonable? Are you going to feel okay doing that? For me, with this vaginoplasty thing, which I've been blocked on for the past year, and oh, by the way, I tried to get covered for breast surgery, and because I couldn't find a therapist, I basically did actually rush that one because I had money saved up for it. And so I ended up just paying out of pocket in the United States. But for the vaginoplasty, I'm not going to pay for it. I think health insurance should really pay for this, but I need to wait 2 years going through a psychologist. And it's been an on and off ordeal. I've tried outsourcing to an assistant who can call therapists on my behalf to find if they're taking new patients. And we called something like 50 different therapists, and none of them were taking new patients. Luckily, I did find someone through a referral who is taking patients, but they are on a different health insurance system, which explains why I have all this paperwork here. And working through the German paperwork system is just super confusing. Each document in Word is like 20 letters, and I don't speak it, so I use my scanner to read this information and try and navigate it the best I can. And it brings me a lot of stress, and it makes me really sad because I feel like I'm stuck sometimes. It's weird to say that because I'm 3 years into my transition, but still, like even now, I'm not complete, and I am sorting and figuring these things out. So I think kind of the last thing that I'll say is mental survival and emotional survival when you don't feel valid. That's probably the hardest thing for you when you're dealing with healthcare, right? The feeling like your concerns are not actually being heard, or feeling like you're at the whim of a healthcare system that basically isn't supportive of what you feel and should be medically covered. That's the hardest part, in my opinion, of being trans, is you need healthcare. You know it's a medical issue, yet it's still not acknowledged or treated like one completely. And that's super frustrating because you feel how do you feel about that? I still feel like I'm not a part of society. I feel like society hasn't completely acknowledged my presence if I can't be the woman that I'm supposed to be and be covered by health insurance by this. It's frustrating. So I digress. But I think the solution that I found is really to just take a step back, put some self-love in there, do some self-care, find support from friends, be able to speak about this in a setting where it doesn't feel like you're burdening someone with this kind of discussion, so you can talk about it more often. And just kind of keep chipping away at it. I've been chipping away at it for 6 or 7 months, and finally I've got this lead with this therapist, and I'm hoping it can work out. If it doesn't, I'm back to the drawing board, and I'm really just pushing on getting this done, and I'm hoping it works out. Wherever you are in your transition and your healthcare journey, I wish you like good luck on that. Like seriously, like it's a hard process, but you can figure it out, and that's probably the more important thing to remember. Is you can figure it out. You can do it. In a way, it's sort of like a wear you down kind of battle. They try to wear you down so you don't do it. But if you take your time, you put in the self-care, and you are consistent in continuing to approach it, you'll eventually make it through and get what you need. I'm sending you some love, some hugs, and some healing energy and vibes. I hope that everything works out. Bye.